still telling the success story about how Nigeria overcame the Ebola virus disease and that certification by the World Health Organization. Well, we're joined now to continue our focus on this matter by Dr. Anthony Okwuosah, who himself is a public health physician with over 30 years' experience. He's a director and head of department, Community Medicine, Institute of Human Virology in Abuja. Morning, and thank you for joining us today. Well, yes, indeed. I mean, the last guest we had was speaking about how the health sector, all the health practitioners need to pull together, as we've done on this one, to ensure that we succeed in this. But yes, you're also elated, we reckon, on the same matter. But what's your perspective on how we achieve this feat and what we need to do next?
Yeah, definitely. It's actually great to be back on channels. I think the last time I was on channels was about 7-8 years ago with Mrs. Session. So it's great to be back. Talking about the issue of Nigeria certification of this free of Ebola, I think we are all very happy, especially every Nigerian needs to be happy about this. We here at the Institute of Human Virology, we were particularly happy because before the first case came into Nigeria, we are worrying here, knowing that sooner or later we are likely to have a case because of several reasons. One, the cases in Liberia, in Sierra Leone, in Guinea, these are the Lassa belt, and Nigeria is also one of the countries in the Lassa belt. Particularly worried because of our population, because of also the public health facilities that we have, the lack of potable water, community, and the fact that a lot of Nigerians don't have good toilet systems and all that, so we worried. And our fears are justified. The virus came into Nigeria. But the government and the people of Nigeria all rallied around and we were able to control it. And this was something that the rest of the world did not believe would happen. And they have good reason, because for years now we've been battling the polio virus and we have not been able to overcome it. We also have the challenges with the transmission of HIV from mothers to their children, and Nigeria is lagging behind in that. So this is one area that Nigeria proved the whole world wrong and we were able to do it. So, but coming directly to your question, I think that I can paraphrase Abiola, the late MKO Abiola, who said that you don't drop the broom you use in sweeping away poverty. So in this case, Nigeria should not drop the broom they use in sweeping away Ebola. We have to learn what were the things we did right, what were the things we did wrong. The things we did right, we have to strengthen it, we have to replicate it all over the country. Every state should have at least one isolation center. Every state should have a rapid response team. The health workers there should know about Ebola and they should be trained about it. Because you would realize that a lot of health workers die when there is Ebola. So our health workers need to know about it. So then it's really what the situation we have, even though we can celebrate, but our celebration should be a bit muted.
All right, yeah, Dr. Okwuosah, I mean, the ministers, the immediate past one, the current one, they've all highlighted the importance of us continuing in this stead, maintaining the momentum and not dropping the ball. Yes, not dropping the ball. But in terms of developing vaccines, I mean, before now, there was this impression that we always had to look outside to see how we could get solutions to this challenge. But what do you think we should be doing? Because there are those who say, look, Nigerian scientists, virologists as yourself, we should be looking inwards, begin all this research, experiments to ensure that we develop vaccines here. What do we need to do? What kind of steps should we be taking to ensure that we can actually develop those vaccines?
Well, vaccine development is high-tech, requires, and government needs to put money into that. We also need to send people out for training in the latest technologies. We need to partner with centers that are into vaccine development. We already have those kind of partnerships. These need to be strengthened. We need a lot of funding for the Nigerian scientists that are doing this. So I think if all these are put in place, we need to send our scientists to go out there and train in centers of excellence and also in such centers. Like here in the Institute of Human Virology, we have a sister organization in Baltimore, and we regularly send our staff there to work with our colleagues in the US. So I think this kind of training is going to be very essential in developing vaccines. But I also think that before we go that far, look at the current epidemic as a war. What we have just succeeded in doing is winning a battle, maybe a major battle. So we need to take the battle out and to the enemy and meet it there. So we need to support the other countries that are still battling with it. And I think the Nigerian government and the Lagos State government have already taken the lead in this, in donating to the country volunteers. But this is one area I need to caution. And volunteers, we need to be very careful how we do it, because it is dangerous to just send them out without plans for if any of them were to come down with the disease, because we at least up to 10% of health workers, up to 10% of the cases of EVD are. So we need to be careful about how we send people out. What are the contingency plans that we have in case any of them comes down with the virus? We need to be able to contain them. Are we going to keep them in the affected country until they get better? Are we going to medevac them back to Nigeria? If we are going to medevac them, then we have to put in place a system to bring them back to a specialized facility that will be able to take care of them. But I personally would think that the best way to involve our volunteers would be to embed them with WHO or with MSF. These are people that are already on ground and working and probably have systems in place for taking care of their workers.
Well, as you said, talking about medical personnel, which is very key here, knowing full well that they are at risk contracting this particular virus. and you say MSF is already there. But if Nigeria were to, for instance, Lagos State already has some volunteers that are ready to go out to help in other West African countries. You know, the rapid response which we used here in the country, which we employed in making sure that the first case was nipped in the bud, how well can these people, you know, use some of these skills and moves by the government and people here when they get back to other African countries, knowing full well that we have seen visuals of some people leaving the quarantine area because of some basic needs they said they wanted?
Well, you know, the epidemic in the outbreak in Liberia and Guinea and Sierra Leone is a little bit different from what we have in Nigeria. Theirs have evolved to involve so many thousands of people and over such a wide area. So the same kind of containment we had here in Nigeria, they have lost that opportunity. So we have a lot of experience and knowledge, you know, textbook-like experience and knowledge that we have acquired here, especially our volunteers in Lagos and Port Harcourt. So they can go there and join and help to bring some of the other workers over there to speed, and also teach them some of the skills that we have used here. You know, so, but like I said, the safety of our volunteers should also be paramount. We have to put in place a very strong system for taking care of them if any of them were to come down with the fever.
All right, Dr. Anthony Okwuosah, thank you very much indeed for speaking with us today.
Thank you very much.
All right, so there you have it. We'll be back in just a moment. We've got other matters on the front burner here today, so please join us again.